Hi, everyone. I'm Erika Del Sordo. Welcome to today's Talk with Erika. Thank you so much for being with me on the third episode of Breast Cancer Awareness Month on today's talk. So this is fantastic. I have a very special guest with me today, Dena Ray. She's new to the show and joins us. Dena is the president-elect for the 2021-2022 BeautifulSelf.org Board of Directors. Dena spent most of her more than 22 years in the for-profit healthcare industry. There, she gained perspective by being able to work with patients, patient support, clinical education, and corporate governance on a national and global level. Dena adds a tremendous perspective because she is a one-time cancer survivor and a current stage 4 fighter. Dena's focus shifted to cancer advocacy and the world of nonprofit with BeautifulSelf.org because of the impact that it had on her life. Now, welcome, Dena. Hi, how are you?
I'm doing great, Erica. Thank you so much for having me on the show today. I am very excited to be here.
I am very excited to have you because, you're going through cancer yourself, and the organization that you're a part of does so much for folks. So you're beautiful, you're strong. Let's talk about beautifulself.org. First off, what is beautifulself.org? Let's tell everyone what that is.
Erica, I am so excited to talk with you about Beautiful Self today. Beautiful Self actually bloomed 5+ years ago out of friendship, love, and the shared experience between Michelle, our COO, supporting Jillian, our co-founder, from her initial diagnosis through to survivorship. Beautiful Self is a breast cancer nonprofit that empowers breast cancer survivors and stage 4 fighters a safe environment to thrive and discover and fall in love with their new self. You have to think about it this way, right? As once we ring that bell and become a survivor, everyone's like, go out there, girl, go out there and kill it. You beat
Right,
cancer. What else could be wrong, right?
right.
And you have to realize that during this time, we have this literal army of support. On one side, we have our friends and our family and our loved ones, and they're giving us love, and they're giving us food, and they're there, and they're constantly checking in. And we have the doctors who are giving us a binder that tells us what we need to do every day. And then we have all the companies that are giving us this stuff. And it's all towards the same goal of becoming a survivor. But what happens 3 months, 6 months, a year down the road when the support is gone because everybody believes, you beat cancer. So, why aren't you thriving at life? And really, survivors like me, and the reason that I first came to Beautiful Self is we're dealing with bodies that we no longer recognize. We're dealing with side effects from the poison we put in our body to kill the cancer or the maintenance drugs that we're on. We have lymphedema, we have weight gain, early menopause. Our body parts are not even in the same place anymore.
Right.
And that, right? And that horrible what if in the back of your head. And people understand, they're like, why are you not thriving? And Beautiful Self really is this wonderful virtual and live community that gives you a safe space to explore, fall in love, and grow, because we dig deep and we dig in, we talk with each one of them, and we kind of peel back the layers that cancer has left behind. And what is really wonderful is that we do this in a phototherapy session, and we give them what we call a diary. It's a forever reminder, and then it's put out onto social media to help educate and inform others. And then we don't want to stop there. We also bring in specialists who will talk
Wow.
about things that, frankly, doctors leave off the table these days: sex in the survivor, dating after breast cancer. All of these things are so important as a well-rounded. We have beauty experts who come in because our hair and our skin is nothing like it was before. We have stylists who come in and help women learn how to dress for their new body. It is a virtual and live community that enables you to see yourself, explore your new self, and fall in love, and really continue to grow. And Beautiful Self is actually part of a community. It's a voice for the often forgotten survivors and stage 4 fighters. And that's Beautiful Self.
Wow, that's an amazing organization. How did you find them? Now, your first cancer survivor, and then you got stage 4 cancer later. Is that Right. So when did you find beautifulself.org? Was it the first time? Was it now when you were diagnosed and you've got stage 4 cancer? When did you find them?
Well, this is actually a funny story. So, I was going through radiation, and Jillian, the co founder at the time, was my radiation buddy. And so we would see each other going in and out every day. And both of us are loud, we have big mouths, big ears, and bald. Basically, face it, we all look alike. But the staff started calling us each other's names. So we kind of had this like immediate bond. And during that time, she said, "We're thinking about starting this nonprofit."
Wow.
And so she kind of laid the plans, but then 6 months later is when I reached out to her because I had finished my treatment and I was in a place that I was not. I survived cancer, but I was not surviving life. I wasn't the same person that I was. That's how I found Beautiful Self. And then we continued to run into each other and touch base. And that's how I ended up finally coming on board and helping as a full-time volunteer and then soon as president of the board.
That's amazing. That's really amazing. I love your work. I do want to ask, let's get into you have metastatic stage 4 cancer. Explain to us what that is because many people hear it, many people only hear it in commercials. What is that? How can everyone understand what you have?
So probably the simplest way to say it is if you asked anybody who is a survivor who has not had a reoccurrence, they would probably say it's their worst nightmare.
Mhm.
But metastatic and stage 4 are interchangeable. And what that means is that your cancer, after you've been labeled a survivor, has come back and it's metastasized and it's spread to other places in your body, like your brain, your spine, your abdomen, your liver, etc.
Wow.
There are some cases where metastatic can be cured, but most often, women like myself are put on a treatment regime to give us a better quality of life and either keep us alive long enough to find a cure or keep us alive long enough.
Mhm.
That is the difference. And based on whichever website you go to, the number always follows. Between 20 to 30% of women who've had an initial diagnosis of cancer
Mhm.
get metastatic. 20 to 30%. That is a horrible number. And with
Wow.
metastatic, about the 5-year lifespan is 22%, with the average lifespan being 3 years after initial diagnosis. So that's metastatic breast cancer.
Wow. Wow. All right. Beautiful self. Wow. Beautiful self now is this a national organization I have to ask or is this strict like you're in New Jersey right now, right? Is
Yes.
this okay. Okay, so now
We
it is a
are.
national organization though.
No, 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 no. I'm
Oh.
sorry. I saw a doctor jump in,
Yes, yes.
so
Dr.
I
I'm from
Badia
was
is
New,
with us.
I'm,
smiling at him.
I'm from New
Doctor
Jersey. I'm from New Jersey, so I have
I love it. I
that's-
love it. You got to love non-live here. So yes, Dr. Badia has just jumped in and I definitely want to talk about it. But Dr. Badia, what we're discussing is Dena Ray is with beautifulself.org and she is currently in stage 4 metastatic breast cancer. So this is what we are
your courage.
discussing. Yeah, and she's stunningly beautiful and
Yes.
strong. And I am just a huge fan right now, Dina, of what you're going through.
Thank you. That's very
Wow.
kind.
Yes, but you were explaining though that my New Jerseyans here. No, you were explaining though that beautifulself.org is not just for folks and like yourself in New Jersey. It's a virtual thing. Anyone in California, from New Mexico, Minnesota, anybody can reap the benefits of beautifulself.org.
That is true. So we have one chapter which is in New Jersey.
Okay.
And right now, our main focus is to maintain be sustainable, really, and make sure that we're serving each and every woman that has signed up for the live portion. And our wait list is a year long prior to COVID. So
Wow.
it's continuing to grow. And with COVID, fundraising in itself is a hard challenge. Fundraising during COVID time seems like it's almost impossible.
Oh, yeah.
So right now we're focused on sustainability. We're focusing on making sure that every woman who wants a live session, who signed up, gets it. But you are correct. Our virtual community with all of our experts, everybody can have access to that. They just need to follow us on our social media sites and have access.
That's awesome. I'll have all those up, but I do want to introduce Dr. Badia. Thank you for joining us. I'm happy that
Thank
you're
you.
back. This is number 2. You were on my second episode of today's talk with Erika back in, I think, March or early April. So thank you for joining me again. Um,
Thank you.
yeah, welcome. Dr. Badia is a hand and upper limb orthopedic surgeon and is the creator and founder of Badia Hand to Shoulder Center in the heart of Doral, Florida, and Ortho Now Walk-In Medical Center. I got that right?
That's right.
Okay.
Too many
All right.
hats.
Yeah. Yes, you do have many hats. And again, thank you for being here with me today. I'm happy to have you on with Dena because Dena's not just, she survived cancer and then now she's dealing with metastatic stage 4. So we've got a doctor's perspective as well as Dena's perspective as, a survivor and now dealing with cancer currently. But Dr. Badia, let's talk about, I'd like to get right into your book. You have a book out, Healthcare from the Trenches. Talk
Yes,
to me about it. Is it new? Let's talk about Healthcare from the Trenches.
sure. It was released in mid-June, and people often talk about what they did during the COVID lockdown. Well, this is what I did. I started the book a year ago with the same publisher that put together this wonderful book um, about experts in pink, which is a woman's guide to breast health, as we know.
Yeah.
And I was honored to write the book on the upper extremity manifestations of breast cancer and its treatment. And with that publisher, I started this book a year ago, which is designed to tell the public what the hurdles and obstacles are to delivering healthcare, which is actually what drives up the cost. And this is something that is not talked about in the political debate. It's actually quite simple why it's so expensive. And the book talks about what the problem is. And then the last chapter is some solutions, and not just myself, but with 27 contributors from different aspects of healthcare, including some patients. So, Dena, I'm sure, is quite an expert on navigating the healthcare journey, such a difficult disease. And the patient's perspectives need to be considered as well. So the biggest challenge with the book really is just getting people to know about it. It's that simple. That's the purpose of all this. I gave my last book. I have more in the office, but I just happen to have it. This is the cover of the book where I'm standing in a trench.
That's
Because
great.
that's really what you feel like. Is you feel like you are in the trenches when you're trying to get an approval for a patient procedure, or you've got to fill out all this paperwork. It's challenging for the patient and the clinician. And I think we need to really make some noise about this, because it's not going to change. The solution is not how many uninsured are you going to insure or pre-existing condition. That isn't going to change the cost of healthcare. Those are important issues, of course, but that's what the book tries to point out.
I like that. I'd like a copy of that. That's wow. That's a
Honored to
great
send
book.
you one.
Well, thank you. Dena, what's your take on that? Given that you are in the heart of dealing with this, what's your take on that?
Well, I have to say that I might have a little bit of a different perspective since I spent the 20 plus years in healthcare, basically being privileged to be able to work along other doctors and surgeons and healthcare and seeing both sides of it. So I probably have a little more savvy with that. However, when you're talking about something that is so complicated with relation to cancer and a reoccurrence and even the initial diagnosis, it can sometimes feel like a game. And so it is trying to find the right people within each organization and healthcare companies. I found personally that through my healthcare insurance, we have something called Nurse Angels, and they are specific to, they deal with cancer patients, and it's their job to help you deal with the bills and the notes
Wow.
and trying to get everything taken care of. But I have many friends and many challenges that I could probably elaborate on with Dr. Badia.
Oh, I'm sure. I'm sure. Dr. Badia, thank you for coming out with a book like that, because it's going to answer a lot of questions for many, 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 many people
You know,
who have those
that's the
questions.
goal. Yeah, that's the goal.
Yeah. So my cousin Cindy Papali Hammontree, she is the one who wrote Experts in Pink, and that book is now in Spanish as well. You have a chapter in that book on lymphedema, Dr. Badia, right?
Yes, yes. Actually, all the upper extremity manifestations, which could be from peripheral nerve problems to shoulder stiffness and contracture, and certainly probably the most dreaded and most talked about complication is lymphedema. And just the other day, a friend of mine asked me to recommend a therapist, and I explained specifically the importance of being lymphedema certified for care of this condition, because the public just isn't that aware, and that's what the book does. Is it talks about that, all the different manifestations. So I was able to reach out to Cindy and get her the name of somebody at the Sylvester Cancer Institute who does that.
Okay. Wow.
Yeah.
I was going to ask, in the sense of both yourself and Dena talking about that, what advice do you give Dena going through cancer? What would you tell her?
The important thing is early recognition. In many cases, there isn't per se a cure, but like many medical conditions nowadays, you can control it. So what's challenging for people is understanding the exact cause, and we're not even sure. I mean, because there are women who get this without even having had axillary lymph node dissection surgery. So it's a puzzling thing, but like many things in medicine, if you recognize it early, it's much more treatable. You keep it under check. The problem is when you ignore it, or you think it's just going to go away. And just like my area of orthopedics, it's smartest to always get an expert opinion early on. And I mean, I'm certainly not an expert. I mean, I don't see a lot of lymphedema patients, but being a hand surgeon, I do recognize it, and I know immediately when to get somebody to the right therapist usually.
Right. Okay. Let's talk about what you do, though. Let's talk about your ortho now. Tell me about that. This way folks know where to go, where to find you, and what it is that you do.
I think everybody can relate to the fact that when you have an ache or pain, which is often musculoskeletal, right? So it can be low back pain or shoulder and knee pain. You kind of don't know where to go. You start with your primary care doctor, and if it's something quite simple, they can usually get you started. But then they might refer you to an orthopedist. It'll take you a month to get an appointment. It's really cumbersome, and it's worse when it's an acute problem. So I could show you a picture of little Johnny, fell at a school the other day and comes in with his forearm like this, just a fracture right here. It looks very scary to the parents, but fortunately the parents had heard of ortho now, so didn't bother going to a hospital where they would be, they'd be hours there, right? Let's face it. And if you go to a general urgent care, which are many nowadays, they don't have the expertise, unfortunately. So ortho now was born out of the fact that you want that convenience, but you need the expertise. And so it's really a musculoskeletal walk-in center. It's exactly what it is. It's an urgent care in practice, but with expertise, with all the imaging there that you would need. And you walk out with the problem often treated. And if it's surgical, like in the case of this boy that came in the other day, the first question we asked is what time, ask the parents, what time did he eat? Because literally we could bring him down the hall, put a block in, sedate him, reduce it, and I put 2 pins, and he was out within hours. That would be an all-night affair, not to mention the cost. We have to be cognizant of cost in our healthcare system. Yeah. There is no reason for those kind of cases to be done in a big hospital, right? I mean,
I remember you saying that last time, that there's no reason to go to a giant emergency room for something like that.
No, you'd be amazing how many, when I used to be called in for, a hand amputation or something, that did need to be at a hospital. I'd walk through the emergency room. I'd see all these people on the gurneys or stretchers with like swollen ankles because they just don't know. And at that time, there wasn't another option. So they would go there. And of course, they're low on the list. Somebody's got chest pain. They're going to come even before the person with the hand amputation.
Right.
Or the kid having a severe asthmatic attack. The ankle sprain is going to be very, very low priority. But it's high priority at an ortho now because that's what we do. And it's not competing necessarily against much more severe conditions. So Ortho Now is it was a franchise, and that was terrible, actually. Franchise and healthcare just don't go together. You can't control the quality. So we are looking for the right national strategic partner. We've already spoken to household names I won't mention, but you can think of big healthcare players around the country. And it's just a matter of finding the right person who has a little bit of vision. Because right now there's 3 centers in Miami. We were in Georgia at one point. We were almost in Michigan, but we pulled back a little bit. So we're looking for the right partner.
Okay.
Yeah.
Okay. And I was going to say, now regarding the big hospitals, the big ERs, and then someone going into Ortho Now, is there significantly might be a price difference? I remember I had gotten one x-ray once, because I thought I broke a rib. I got a $20,000 bill for that.
Well,
So I don't
those bills for the consultation by the ER doctor, then the hospital bill for the facility which is big, then the x-ray, and then there's probably something else done.
right.
I mean, the New York Times wrote about that, somebody with a busted lip, $500 per stitch. That's a famous article. And it's because in the hospital, the acuity of the problem is not taken into account, right? And they have to pay for these expensive, intensive care units and all these other things, which are very needed in the healthcare system. But the cost is spread to everybody. And it does. And then, of course, nobody really pays that. I mean, I think we all know that, right? Nobody pays $20,000. Certainly the insurance company
Luckily,
doesn't.
that one went through the insurance, by the way.
Right, but they don't pay that either. They don't pay that either. So one of the things I know at the current administration, and I don't know what's going to happen in 2 weeks, but certainly there is a need for transparency in healthcare pricing. So let me just be totally transparent. If you have no insurance, or you have one of these these insurance plans, you have to be in network. It's really terrible. You busted your ankle, right? And you're in Ortho Now. To me, maybe I'm wrong, but to get in and out of there for about $300, potentially with a cast, and to be in and out in less than 90 minutes, I think that's pretty good. That's kind of what the self-pay cost is.
Right.
So we are talking to a lot of national companies, which are talking more about just paying for your care. Very reasonable. You put it on your credit card or something, but I think that's going to disarticulate the whole healthcare system, is that we're going to see that the less severe things are going to be paid for somehow by patients, and insurance is going to be more for catastrophic things, a malignancy or a liver transplant. But it just doesn't make sense, because you end up paying all these premiums, and then when it's time to use it, many times you can't. There's too many hurdles.
Yeah, that's very true. Dena,
aren't many of the insurance companies moving towards, is Ortho Now considered an ASC? Aren't they moving more of the procedures like that out into and now reimbursing, especially with the DRGs and?
Absolutely. That's a great question, but let me be clear that Ortho Now is not a surgery center. It is closely affiliated one, because roughly 20% of the patients who walk into an Ortho Now need procedure. Might not be then and there, but may need it, a week later. So Ortho Now is just the urgent care, the walk-in component. But to your question, yes, the entire healthcare system, largely pushed by COVID, is looking much more at outpatient solutions. And the byproduct of that is we're going to save a lot of money. I've been touting this for a decade. I can show you an article in the Dade County Medical Association Journal where I talk about specialty clinics, outpatient clinics, saving time and money. That was published 2011. I can tell you, it wasn't even noticed. Nobody even asked me about it. And now all of a sudden I'm being inundated with requests for interviews about this, because all of a sudden people realize it's a good thing because of some pesky little virus. But, before COVID, there is MRSA, right? Dena, you probably know, you've heard of MRSA. I mean, that's a really difficult bacteria to treat.
Yep.
And there are other nosocomial or hospital-acquired infections that unfortunately, are prevalent in hospitals. And we talked about the cost already, right? The $20,000 bill, Erika.
Yeah.
Right? That you don't get that in the outpatient. So in Doral, you can actually go to DoralDoc, D-O-C, DoralDoc.com. And on that website, you'll have the OrthoNow link. You'll have some of the physicians, including my own practice, in there. You'll have the surgery center website, and you'll have the rehabilitation website. And it's all in one outpatient building with easy parking. And you don't get a ticket to park. You can just park like the old days. You just park and walk in.
That's great.
Don't we all miss that? Like,
Right.
Life has gotten complicated.
You got to get
right?
it stamped by 8 people.
Yeah. And, or you go to a parking garage and you're looking for, we have we're fortunate, really big parking lot right off the Palmetto. You can literally see the building from the Palmetto. And you just park and you limp in or crawl in or whatever, and you get treated.
That's great.
It's very different. Yeah.
That is very different. And that's what every single healthcare facility needs, because you're so right. It's such a pain in the butt. And by the time anyone walks inside to see the doctor, they're aggravated by what happened on floor 3 in the garage.
Right. Well, the other thing we do is we're very much kind of like, Chick-fil-A. We're very driven by the patient experience and customer service. So all the staff, I've read it twice, has to read, I have it in the office. It's called The Endangered Customer. And that's a great book. You can read it in 2 nights. The Endangered Customer by Richard Shapiro, who's in Fort Lauderdale actually. And then there's a book called Beyond Bedside Manner. So these are things, mantras that we go by, because we think that healthcare should also be pleasant and polite, and right, we kind of lost that. Yeah. So these are our goals. The biggest challenge, besides just awareness, and thanks for your show, Erika, that this certainly helps a lot. Besides that is the insurance companies. If we could get more dialogue with them, because we have the same goals, right? They want to save, they want to save money, right? And yet you would think they'd be banging on our door. It goes to show how rough the healthcare system is. That an idea like ours, it's now been around 10 years, is still not, top of mind.
Yeah, I really appreciate you bringing this to light, because not a lot of, especially doctors, want to talk about it. So thank you for talking about it, and thank you for your book. We need to get that out there. Yes. We'll definitely promote that, and I definitely want a copy. Dena, I don't know if you want a copy, but we want copies of that book, because that is that's something else that you wrote that. So thank you.
No, my if both of you send me an email with your address, I'd be happy to send you a signed copy. And all I ask is that, you're both people, you can tell, I mean, you're out there, you're educating, is just, let people know. The easiest website's drbadiabook.com, but you can just go Healthcare from the Trenches on Amazon. It's in Kindle and paperback version.
Okay. All right. Well, thank you for that. Dena, let's talk about, I think you were in Cindy's book, were you not? Do you have a part in there? You do not. Okay. I thought there was. So
that's okay.
So how do you?
If she's open to it,
it's funny. In our last show, we were talking about that. I had Dr. J on as well, and we were talking about, is there a 4th book coming out? Because Cindy, I think there's a lot of content here. A lot more people you need to add in there, especially Beautiful Self. But how did you 2 meet?
Cindy and I?
Yes.
Actually, Cindy and I met via LinkedIn, and we kind of started talking and connecting.
I love social media.
Social media is fantastic. And actually, I started seeing all of her promotion with regard to her book, and then it coming out in Spanish. And then she started supporting Beautiful Self. And then we had a live conversation. We've actually been talking for about a year now, and now we're finally here at this place. So it's fantastic.
It is fantastic. All right, so tell me, where can folks find Beautiful Self who are interested? It's just beautifulself.org, and I'm assuming you're on all the social media channels. Is that right?
Correct, correct. So Insta, Twitter, Facebook, uh, TikTok, even. We're getting
Really?
going there. We're
Okay.
starting. We're starting because we've got lots of it. TikTok, every site, basically. Facebook, we're on there, and we have our website. It's www.beautifulself.org.
Okay. All right. Well, thank you
And you can
very
go
much.
shopping, right? The ladies can go shopping and donate money, right? Which is
They
great.
can donate
Yeah.
money. That would be great. And we do have some folks that we do support and advertise for, like lymphedema sleeves, or where you can get
Oh,
wigs, or help with insurance. We also have on our website one of our MSs, Annette Tello, actually put her calendar up on our website. So any woman who wants some mental health support can book a free appointment with her. It's fantastic. So you can find Pam, one of our stylists, is on our website, and she helps women dress for their new bodies. So we have a lot of information right there on that website.
I love that. I really do. That's what so many women need. And that's for even survivors. Anyone who just wants to use beautifulself.org. That's fantastic. All of the links that we've mentioned in this show, again, go into the info and about me sections on all the audio podcasts and YouTube. And then you can find myself and Dr. Badia and Dena Ray on social media. And again, I'll have where you can find everybody. We'll get Dr. Badia's book in there, and anything you need to know about this show is going to be in the info section. So to the both of you, I don't know if you want to add anything, but I can't thank you enough. I just wanted to wrap things up. Dena, thank you. You've spoken a lot about beautifulself.org and what a great organization. You're a beautiful woman, and God bless you going through this right now.
Thank you so much for having us on here, Erika. And I have to say that I talk about Beautiful Self because I believe in it, because I'm just going to share this one little story about
Please.
me to let you
Yeah.
understand why Beautiful Self is so important. Because a lot of people, you have Cindy on and you have other survivors that you're talking to that seem to be thriving. And that is fantastic, because there's a bunch of women who make it through their first diagnosis and they become a survivor and they're on their side. There are a lot of women like me who couldn't look at themselves naked for 2 years. I didn't know how to dress anymore because I am on the stage and I'm in hospitals and I'm doing this and I have a body I don't recognize. And it's things like that that we keep deep down and hidden. And Beautiful Self lets you jump in and explore it and find yourself in a safe environment with women who understand what you're going through. So if anybody is out there who is interested, we would love to talk with you and show you what we're all about.
I have a couple of friends who are going through cancer as well right now. So I have a feeling you'll be hearing from them. And I know that you were discussing the organization needs donations. COVID hit everyone hard. And of course, a lot of people lost a paycheck, but the nonprofits shouldn't suffer. So you'll be receiving my donation as well. I know you guys need it. So thank you for sharing. That's a fantastic organization you're with.
Thank you. Can I just make one mention though?
Go ahead.
For the donations, if you want to know, we have 95% of every dollar goes directly to the cause and the
Fantastic.
community. So none of us are taking salaries. Our volunteers are not taking salaries.
Mhm.
So your donation counts when you give it to Beautiful Self.
And I thank you for adding that, because a lot of people ask that. A lot of people don't want to donate because of bad things we've heard, and we won't get into that. But I appreciate you adding that, because that's very important for folks to know.
Thank you.
Thank you. Dr. Badia.
well, I'm humbled by that, and I honestly, I don't want to talk about the book. I'd like to relate a story. When I was a general surgery intern at Bellevue, the private hospital was the NYU Medical Center. Now it's called Langone. And I remember I was on the service, and the chief resident asked me to go to room 26 something and remove the staples on a patient. And I walk in, and it was a very attractive woman. I was in my mid-20s, and I remember she had to, lift her shirt, and I had to remove the staples from her mastectomy. And it to this day, it impacts me to think about that. It was such a difficult moment for me as a man and with a woman who obviously had gone through this trauma. So I think what you're doing, and I mean, that's why when I was asked to write this chapter of the book, it was just no hesitation. So, but those are, you know, we count a lot of incidents in my book in the first section that, you know, impact physicians. And I just wanted to relate that one story about removing the staples on a breast cancer survivor.
I appreciate you sharing that story. It's one that a lot of people need to hear. In a quick mention on my own, I know that we've discussed in previous shows with breast cancer about how, you know, once someone does ring the bell, it's not over. It's not just, hey, you survived it. Excellent. Great. You know, and everyone forgets about what you had gone through. It's a lifelong journey. It's just a lifelong journey for anyone who's suffered through that. So, Dena, if I can do anything for you, you let me know.
Thank you, Erika, having me on here and letting me talk about beautiful self and a little bit about myself has been great. Thank you for your support with this. I appreciate it.
You're absolutely welcome. Thank you for sharing your story, and thank you for offering up beautifulself.org for the show, because a lot of people do need to hear about it. And Dr. Badia, I can't thank you enough. I know you're a busy man. You've got so much to add with your book and, of course, the chapter in Cindy's book, Experts in Pink. So thank you very much. We'll have, again, all of the links for wherever you need to find anything.
Thank you.
Healthcare from the trenches, folks. All right. Thank you very much. Have a great day.
Thank you, Erika.
Thanks for listening to today's talk with Erika. Join me next week for another discussion with the experts who help make life easier. Please visit my website, erikadelsordo.com, where you'll find all of my social media platforms and more. And be sure to subscribe to my YouTube channel. Once again, thanks for listening.